Inflammatory bowel disease refers to a group of illnesses that affects the small intestine and colon. Hi, I'm Rebecca Brayton and welcome to WatchMojo.com. And today we're speaking with the Crohn's and Colitis Foundation about these diseases. What are inflammatory bowel diseases and how common are they?
They're autoimmune conditions that affect any part of the digestive tract. So they cause inflammation, sores, bleeding, and a lot of symptoms that include pain, abdominal cramping, fatigue, going to the washroom a lot. And so they affect all aspects of people's lives.
Would you be able to outline the difference between Crohn's and colitis?
Crohn's, it really can occur anywhere between the mouth and the anus, so anywhere from gum to bum, as a friend once described it, and it's more patchy inflammation that affects a deeper tissue, and colitis is more localized in the large intestine, but more continuous inflammation.
At what point in life do these problems usually manifest?
Most people are usually diagnosed before the age of 30. So we're finding that now more people are being diagnosed between the ages of 15 and 24, but some people do develop it later in life.
How are the diseases diagnosed?
It's not always easy. Usually people come in with stomach pains with a lot of those symptoms, but it's not always the first thing that the doctors jump to. So it's not easily diagnosed. There are tests that they run to determine whether or not the patient has IBD.
What plays a factor in terms of the causes of the disease?
Well, we're not too sure, and the foundation does fund a lot of research on that, which is really important, but they do know that there are genetic factors. They figure that there are also environmental factors as well.
How does stress factor in?
Definitely, stress is certainly, once you have the disease, it's also a major trigger for flare-ups. So stress is definitely something that as patients we try to avoid, which isn't always easy.
Is there a cure?
There is no cure, which is why the foundation is so incredibly important, because that's their mission, is to find the cure for IBD.
And would you be able to outline to us how it affects your day-to-day life and maybe how you're able to lead a normal life or not?
Well, it was a lot harder when I was younger. When I was first diagnosed, I was sick for many years, about 8 years before I entered any form of remission. So I did have to miss a lot of school, did a lot of school from home. When you're really sick, you're not feeling well. It's not easy to get out of the house, to do things. You're very lethargic, not much energy. So it can be quite hard to lead a normal life. Certainly for a lot of my friends who have IBD, if they're stuck in the bathroom all day, they're not going out and doing much. Once you're in remission, I've been very lucky that I've managed to keep up with schoolwork and have an everyday normal life at this point, but when you're really sick, it's very, very difficult.
IBDs are not often spoken about. Why do you suppose that is?
I think because of the nature of the symptoms. Certainly people with IBD aren't always comfortable talking about the symptoms, and then a lot of people aren't always receptive to hearing about them. So it's not the most pleasant thing to talk about, how many times you're going to the washroom or how much pain you're in, but at the end of the day it's important. And so we're looking for people to be a little more open to it on both sides.
Thank you very much.
Thank you.